Hi, my name's Phil. I like to talk about politics, and it's been noticeable this week that there is not so much a social distancing, but a political distancing from the Health Secretary, Matt Hancock. In this video, I begin to wonder if he's going to end up carrying the can for the wider incompetence of the government. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So, don't get me wrong, I'm not going to be approaching this from an angle of sympathy for Matt Hancock if he ultimately takes the blame for the myriad cock-ups during this coronavirus crisis. He is largely responsible. He is the Health Secretary. Not responsible because he's incompetent. He's actually one of the very few competent ministers in Cabinet, but because of his complete lack of moral fibre, preventing him from standing up for his department and, by extension, the people of Britain. And this won't be the first time I'm giving him a bad time this week. Journalists are increasingly asking why we have not been ordering enough PPE for healthcare workers, especially frontline NHS staff, trying to deflect the question by saying that there's unprecedented demand in the world doesn't really cut much ice when you can see that other countries are managing. We are missing out on taking part in the EU Procurement Scheme, and news keeps coming out all the time about British manufacturers of PPE that are not getting orders from the UK and are instead exporting their work to countries who do want to protect their citizens. A few days ago, you started to get the impression that people in government were distancing themselves from Matt Hancock's claims of 100,000 tests per day by the end of April. It was impossible when he said it, quite frankly, especially as we weren't even ordering tests. And, we were also turning down offers from laboratories to process those tests, because that's the other thing they try and say. If they try and tell you, we can't get enough tests, and then you point out a company that says, actually, we make tests and you don't seem to have ordered from us, then they change to, yeah, but it's all right having the tests, but we need somewhere to process them. So what do? You have laboratories that go to the government and say, we've got the equipment and staff who can process these tests for you. Would you like us to help? And the government say no. So they don't really get to say that either. So we've turned down large supplies of tests and we've turned down laboratories for processing them. So whatever is the reason why we're not increasing the level of testing that we're doing, it is a political decision, not one based on capacity. In fact, the number of tests being conducted each day is actually going down. It's not even going up by an inadequate number. It's going down. Ministers keep telling us that our capacity for testing is going up. But the bottom line is what matters is not what you say the capacity is. It's how much you're actually testing. Because our capacity is how many tests a day we're doing. We can't argue we're in a situation where we've got this capacity but there actually isn't that demand, because that's what they've tried to say. There's massive demand. There's people who cannot get tested all the time. There's still frontline NHS staff who are not being tested that need tests. Healthcare workers not being tested that need tests. You've got just normal members of the public should be tested if we've got the spare capacity. If anyone reports symptoms, they should be tested. The only excuse for not testing them is to say that we can't test everyone that needs it. But if you're saying the capacity is higher than the actual amount of testing being done, well, that argument falls flat as well. And before we come out of the lockdown, we're going to need much more testing than 100,000 a day, which again is not going to happen by the end of this month. A figure of 500,000 a day is being put forward by some experts. So a little bit of political distancing has already been happening with various people when asked about this claim about 100,000 a day by the end of April, going, is that what he said? You might want to ask Matt Hancock about that one. But then there was the explosive admission on Tuesday about the EU Procurement Scheme for medical equipment. So the way that worked is the government had initially said we didn't join because we weren't EU members and we were going to do things our way. The problem with that is there was then a massive public backlash, because although that sort of attitude would have played well to the hardcore Brexit crowd, that's not the majority of the public, even though they will try and suggest otherwise. So there was a huge backlash from the general public who went, no, that's a really stupid idea. So they immediately changed tack into saying that they didn't know they had been invited to join. We missed the email, or it went to an email that's now defunct, is what they tried to say. Now, we know this to be a lie. When I say we, I mean anyone who doesn't just get their news from the mainstream media, because, well, I know we were invited to join before the deadline because I saw it in the national news. It was in the Guardian, it was in the Independent. At the very least, that we were being invited to join before the deadline happened. So if I saw it in a national newspaper, yeah, the government did too. But also, there have been meetings that took place between British officials and ministers and the EU to discuss this procurement as far back as January. Yes, we missed some of the meetings, but we did attend some of them as well. And even the reason we missed the meetings was because Boris Johnson told Matt Hancock not to send officials. So we know that the scheme was being discussed, and there are minutes proving that we were invited to join and basically said no. But then, as Parliament reopened this Tuesday, the most senior official in the Foreign Office was forced to admit that it was a political decision not to join. He tried to be evasive, as you do. Your officials are there to back up their ministers, which unfortunately brings them into party politics at times. But they're not party political, so they can't actually tell a lie to other MPs in a select committee. So when the question was put really, really clearly to them, they did have to admit that it was a political decision. Then there was a massive blow up. So Matt Hancock found himself having to stick to his missed email story, which means having to say that the senior official got it wrong. In actual fact, they forced that permanent secretary of the Foreign Office to write a letter retracting that statement. And a great number of people who have been commentators and have worked in the civil service themselves have said that the letter itself is clearly forced. And we know it would be anyway. The idea that such a senior civil servant would have got something like that wrong is absolutely ridiculous. They know exactly what is going on. But then what Matt Hancock tried to say is, look, we had this thing, then we found out we were invited, so now we have joined, so we'll be ready for the next order when it goes in, to try and muddy the waters. It's one of those things where some people will say, okay, you got it wrong, but you've corrected it now, fair enough. But that's not true either, because no sooner had Matt Hancock said that than the EU Commission said, no, you don't seem to have joined. You're still not in, so if we do another order, you're still not included because you actually haven't asked to join. Are you asking to join? Is that what you want? Because we don't seem to be. So the situation is that we have run out of PPE in some hospitals. We were ordering too little, too late. The news came out yesterday that the government have missed out on orders for 16 million face masks in 4 weeks. We have British manufacturers of PPE, ventilators and COVID testing kits that work, more importantly, not receiving orders from the UK government because they keep ordering from places where the tests don't work because they're new and experimental. And they're obviously not receiving orders from the NHS either because they haven't got the money to do so until the government loosen the purse strings. And the criticism for this unforgivable chain of events is not going to go away. At least I really hardly think it can, especially when you've got right-wing media now having a pop at the government for it. And there is likely to become a point where someone has to carry the can. And you get the distinct impression that it's going to be Matt Hancock. It won't be Boris Johnson, even though he is actually responsible. It was reported, for example, that Matt Hancock wanted to join the procurement scheme. He wanted to coordinate with other European health departments. It's Boris Johnson that blocked this. But that is not what's going to be reported. It'll be Hancock paying the price if anyone does at all. The newspapers are already saying that we're in this mess because Boris Johnson was taken ill and it'll be better when he comes back, as if all of this wasn't happening beforehand. They'll shield him from criticism and allow him to blame his ministers if the public backlash becomes too hot to handle. Commentators are already saying that those close to him in government may be about to find out just how little loyalty Johnson really has and how ruthless he can be. And it does look rather like Matt Hancock, who, let's face facts, is not a natural ally of Boris Johnson either, may well be first in line. But that's my reading of the situation anyway. Let me know what you think in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.